Good morning. My name is Sajid Jalil. I'm a clinical associate professor at the Ohio State University. On behalf of my co-authors, I'm presenting this poster, which was presented at DDW 2023 this past May. The title of this poster is Use and Outcomes of Hepatitis B virus positive grafts for renal or heart transplantation in the United States from 1999 through 2021. To give you background, the gap between demand and supply for solid organ transplants continues to widen, requiring strategies to expand the donor pool. The use of hepatitis B virus positive grafts and liver transplant without impacting the graft and patient survival has been reported. However, the outcomes of kidney transplant or heart transplant recipients with HBV positive grafts from deceased donors is not known. Methods. We examined the outcomes of recipients undergoing kidney transplant or heart transplant with HBV positive grafts, that is, HBV surface antigen and or HBV nucleic acid test positive from deceased donors using the UNOS database from January 1st, 1999 through June 30, 2021. Propensity score matching 1 to 5 was done for kidney transplant recipients of HBV positive with HBV negative grafts for transplant year, recipient demographics, donor age, and serum creatinine at transplant. Similar matching 1 to 10 was done among heart transplant recipients for transplant year and recipient demographics. Results. Among 898 potential donors, 448, which is 0.24%, were HBV positive with 996 kidneys and 448 hearts available for transplantation. Of these, 352 kidneys, which is 35.3%, and 56 hearts, 12.5%, were transplanted, with 332 kidneys and 53 hearts in HBV negative recipients. Although use of HBV positive kidney and heart grafts increased over time, 60% of kidneys and 94% of heart grafts were discarded in 2020. Among kidney recipients of HBV positive and negative grafts, 10-year graft survival rates were similar at 47.1% and 49%. And respective patient survival rates were 58% and 59%. Both are statistically non-significant. Similarly, among heart transplant recipients of HBV positive and negative grafts, 10-year graft survival rates were 41.9% and 38.9% for graft survival and 54.3% and 61.2% for patient survival. Again, both statistically non-significant. Outcomes were similar in subgroups with HBV grafts matched with HBV negative grafts based on hepatitis B surface antigen, NAT, and anti-HBV serology. On the right panel, you can see the graft and patient survival. You can see the top graph shows graft and patient survival for kidney recipients of both HBV positive and negative grafts. Both lines overlap, and a p-value is non-significant, showing that there's no difference in graft and patient survivals. The lower half of the graph panels show graft survival and patient survival for heart transplant recipients for HBV positive and negative grafts. And again, similarly, you don't see any uh, significant change over time in graft and patient survival, suggesting no difference. Conclusions, these observations were in that use of HBV positive donors for kidney transplant or heart transplant did not impact the recipient graft or patient survival, suggest that it is a reasonable strategy to expand the donor pool and lower the waitlist mortality rates among candidates waiting for kidney or heart transplant. Thank you for your attention.